speaking to Owais Durrani, who is an emergency medicine physician in Texas. And I started by asking him, what is it like being a health worker in the US today?
To be honest, it's kind of sad, especially, on a day like today where, the CDC is something as a child and then someone who went into medicine. I looked at it as the pinnacle of public health in the United States. It's something that had sentimental feelings, but then also as a healthcare provider, it's something I look to for all types of guidances, from guidelines and policies to, different rates of different diseases, to things like, hey, is there antibiotic resistance for certain types of things in my community, and the CDC will have resources for that. And the fact that that is not a reliable source anymore and something that I can't really turn to with a great degree of confidence is sad.
Talk to me a little bit more about some of those impacts you're seeing in real life when big organizations or leading institutes in America you're seeing this kind of disruption. What are some of those real public health impacts for patients as well as you as a health worker?
Data is what we have to rely on for all of our decisions. Data about, what are the number of measles cases or COVID-19 cases in Texas? What is going on when it comes to, things like the availability of certain medication? Do we have a issue with increased rates of diabetes in our community? Should we be doing more? All of those things rely on data. Overdoses. We have a huge problem with opioid overdoses and the data and numbers around that and how we can tackle that. When we don't have that data, it's hard for us to make those decisions for our patients and to be able to give that recommendations and guidances to them with confidence. And so then we're relying on things that are more localized, like hospital level data or county level data, and that is only going to give us a part of the picture rather than having the whole entire picture and the resources of the entire federal government.
So where do you think things go from here? What do you think the direction of travel is?
From what we've seen, it seems like anyone with the intention of following the science and, actual trials and numbers and data, they have been pushed out or are being pushed out. And so from my perspective, I'm going to have to rely on medical societies, right? So the American College of Emergency Medicine Physicians, or ACOG, or the American College of Family Physicians, organizations like that are still, based in data, and they're going to provide their guidances. We've seen the American Academy of Pediatrics say that they're going to diverge from the CDC when it comes to